Hi, my name is Josephine Tafie. Student with Brackman University. Presenting on course 641. Instructor name Dr. Deborah April. I'm presenting two case studies on Thorazine. My first case study is talking about patient name MJ. Actually, MJ lives in Texas. In a rented apartment. She has no formal employment and does small errands whenever they are available. She is a school dropout. She dropped out in senior high school due to bullying from her schoolmates. She has been arrested and placed on parole once for being violent, but has not engaged in such an activity again. She struggles financially, which make her anxious most of the time. She lives alone and has no kids, husband or roommate, and avoid talking to her neighbors or claim to be shy. She does not have a religion. Um, Patient was born on underage and had to be placed on an incubator for 2 months. She has no other record of her medical history, no current medication, no known drug allergy. Patient grown up in a violent environment. She was born in a family of an alcoholic father who was violent and abusive and later confined in a mental hospital. Her mom suffered from depression and has been attending a community support group. MJ presented herself to the hospital neatly dressed and did not show any signs of physical pain. She had no symptoms of weight loss or fever or any report on pain in the eyes. Her visions are also okay. She could hear, smell, and swallow properly. Vital signs seems okay. Laboratory reports shows that she was drug-free and non-pregnant when she came to the hospital. MJ is well dressed and cooperative, though she is easily irritated by some questions. Her speech is normal at one time, and she had a stutter in her speech. She has a fair cognitive ability and has motor skills, and her motor skills are okay. She, however, claimed to have suicidal thoughts. Strength and limitation. The patient is cooperative with the medication plan given, however, and she is easily distracted when asked questions. The patient assessment and diagnosis. The patient exhibits symptoms of schizophrenia, which is characterized by anxiety, hallucination, delusion, and withdrawal from people. Informed consent. The patient understands the need for taking medication and is willing to do so. Plan medication. The patient will be put on Thorazine as it is helpful in treating schizophrenia. She is further support to attend psychological therapy once a week with follow up on her progress using her address. So I will move into case study 2, which my patient initial is KR. The KR actually is 31 years old male. He is married and a father of two. He has a former job at a big company and has recently been promoted to be the departmental health. He presented himself at the clinic due to anxiety, sleepiness. He has been recently experienced chief complaint. KR complained of developing anxiety and stress, leading to sleepiness since he was promoted. KR was recently promoted in his job place, and the added responsibility has been making him feel overwhelmed and stressed out. He is feeling unworthy of the position. He has stopped engaging in activity he once enjoyed, such as spending time with the friends, family, attending gym. He is taking a lot he is thinking a lot about his job and cannot concentrate and focus on one thing. KR has been a hardworking, resilient, organized, and ambitious young man who has who has no psychiatric history. He has faced challenges, but they never affected him as he was resilient enough to bounce back. He was raised in a lovely family, and his parents always supported him and his dreams and ambitions, which gave him a strong sense of what he was doing and where he was headed. He was allowed to speak up his mind freely, socialize, and interact with different sort of people. He was a natural leader in his school, well interacting with his schoolmates and teachers. Kearo had had a fractured bone in his arm after he fell while playing football. He also has a record of pneumonia as a child, which was medically treated. He further medicates he No further medical history has been recorded except the common flu. KR is generally healthy man and is not under any medication. Um, he's allergic to peanuts. Family psychiatric history. KR's family has no record of psychiatric disorder. He came from a family that understand the importance of healthy behavior, habits or behavior, including both mental and physical. His father is a local pastor who hold many meetings teaching people about the need and avoiding emotional problems. KR lives in Los Angeles, California, with his wife and two children. Their parents live a few blocks away from their house and they do frequent visits. He has many friends and meets them every Saturday at the golf club. He is also a good team player who make sober decisions which make him boss which make his boss promote him. The patient exhibits stable vitals. His eyes, ears are functioning well. He has fine motor skills and fluent speech. He is smartly dressed for the occasion. Lab seems okay. The patient is well cooperative and is stable enough to follow the doctor instructions. The patient is willing and ready to follow the recovery plan given. The patient is fine and does not need medication. He is stable He is a stable man running his family and job well. Being stressed by day-to-day issue is normal and does not need prescription. Patient actually can follow the doctor instruction in terms of the consent. The patient does not need plan. The patient does not need medications as they are not ill, but undergoing stress due to shift in responsibility which is expected. They do not need therapy and the pressure will disappear over time. However, he should try to get enough sleep. In my conclusion, Thorazine is used to treat psychotic disorders such as schizophrenia, which is characterized by sleepiness, hallucination, and withdrawal. Thank you.